Hello, Gary Crowley here with DoItYourselfJointPainRelief.com, and this is video 5 of 5 videos for frozen shoulder exercises and treatment, where we teach you how to fix your frozen shoulder all by yourself. And basically in video 1 we reviewed kind of the reasons why we're going to do all the stuff we did in these videos. Video 2 we started by freeing your 11th cranial nerve up at the top of your neck that innervates your trapezius and helps your shoulder work. Video 3 we did your mid and lower trap and maybe a little bit of your lat and your muscle called your serratus anterior down here, just making sure all this is free to do its job. In video 4 we freed these muscles, your serratus anterior that helps that shoulder work properly, your teres major and minor, and your subscapularis stuck here, hidden in that armpit of yours. And now that, especially that we freed your subscapularis and your teres muscles, now we're going to get up in here in your quote shoulder muscles, because now that this stuff is free, all this stuff will tend to work a whole lot better. So basically what we're going to do here is, I'm imagining that I'm pretending I have a left frozen shoulder here. So basically what we want to do is we just want to start with making sure all these muscles that attach to your clavicle are free, basically. So you poke in here, investigate around. There's your subclavius under here, not that it matters. But then there's your pec, and then under your pec is your pec minor. But any of this, if you poke in here, again, healthy tissue is not painful or tender when you press on. If it's tender or painful, you got to do a little press, pull, release, press, pull, release, press, pull, release. You can maybe do a little press, hold, move if your shoulder's starting to move a little bit more. But either way, work with that tissue a little while. Again, all this is on my techniques page, how to do these a little more specifically. But again, you're grabbing, you're not massaging, you're grabbing a layer of that tissue under the skin and you're stretching it, and you're grabbing it and you're stretching it and you're grabbing it and you're stretching it. And eventually your cerebellum says, oh, we should probably reset those tension settings for that muscle from that technique. So free all that stuff, your pec minor, your subclavius, and then you can come around to your delts, what most people consider your shoulder muscles. And again, if I have a left frozen shoulder, I'm going to reach all the way around to the back of my delt. Just make sure that's not too tight and too what I call jacked up. You can do press, pull, release, press, pull, release, press, pull, release on it anywhere it's tight. Or again, if you can get a little motion in that arm, you can do a little press, hold, move too. And then you come to your medial delt here and press in there, see if any of that's tender. Again, press, pull, release, press, pull, release, press, pull, release. Or get a little movement in there as you just press on that tight spot and make that muscle function under that pressure. Then you come to the front. I like to use my front on this anterior delt. And you're going to press in here. Now these tend to be pretty tight for modern living, driving, computing. If it's tight, little press, pull, release, press, pull, release. Again, just take your time. Only work at the level you can relax into. And when that lets go, sometimes underneath that, there's your biceps tendon. And if you press in there, now your biceps tendon is kind of right on this head of your humerus bone here. It's going to be a little tender anyway, just because it's a tendon on a bone, but you just want to make sure it's not all stuck to that humerus. So if it's really tender and you're not pressing that hard, it probably needs a little attention just to free it a little bit. You can, move your lower arm a little bit to get that bicep tendon moving a little bit, and just to make sure it's awake. And again, I'm just kind of doing this just to get that whole bicep, make sure that's not all stuck to that bone, because we don't want that hanging things up now that we've done all this other good work to free things up. So we've done under your clavicle, we've reached around, we've done all these delts, we've done your biceps tendon, and now we're going to get back to basically your upper outer trapezius here, which again, this trapezius helps move your shoulder blade out of the way when you go to lift your arm up. So we want to make sure that's extra free. You can even come all the way over to the kind of where your neck and shoulder come together. You can do a little a little press, pull, release, and this is nice because you have all this leverage. You can almost use the weight of your arm a little bit to come around. But you can also do a little, if your arm is now moving, you can do a little press, hold, move, press, hold, move. If your shoulder can do that. If it can't do that, then just do press, pull, release, press, pull, release, press, pull, release. And so you're going to do this, make sure this trapezius is nice and free. Now, just to the front of that trapezius, if you you can almost push it out of the way a little bit and then press down. That's your supraspinatus muscle. And again, you can move this arm a little bit to try to get that going. That goes all the way out here and attaches to that bone right there. And it helps, it helps in the lifting of your shoulder, and it hurts the lifting of your shoulder if it's all stuck and tight. So we just want to make sure while we're here, if you can move that arm a little bit, great. You can feel that tissue move under the pressure. If you can't, then again, just press, pull, release, press, pull, release, press, pull, release. And actually this one, even this upper outer trap here, this actually feels pretty good even when it's tight usually. Usually it's like, someone comes up and rubs your back from behind, they're pressing on these things. It actually feels, it's that, wow, that it hurts a little, but it feels good. And for me being on the computer too much, this just plain old feels good. So we've done this, we've done all this, we've done all this. Now, basically what you want to do, especially if you've given some good attention to that upper trap and that supraspinatus on the way out, we've freed, basically, or we've at least worked on all the things that can basically be causing your frozen shoulder, unless, you've ripped a tendon off the bone or something, which you would, I assume, know about at this point. So what you want to do now is you want to assess, is your shoulder 50% better? Is it 40% better? Is it 98% better? Whatever it is, you can now go back to videos 2 through 5 and go through the areas that need some more work. You can just go through them, and if they're not tight, you just skip them and go to the next area, and you'll probably find some areas, your serratus anterior might still need a little work because it was a little tough to get at before, but now that you can move your arm a little better, you can get at it. Your upper trap and your neck might, need just a little bit more work to make sure everything's free, but you'll find some of the stuff is great, some of the stuff needs a little more work, and as you go, you come around, you're lifting things, you feel a little tension in the front of your arm, okay, you give it a minute or two on that anterior delt, suddenly, wow, you're on your way. And again, this along with any of the exercises that the physical therapists tend to give you, or these, where they want you to do your arm. This is great because if you feel restriction in that muscle, you can just press on that muscle, press, pull, release, press, hold, move while you do it. If you're climbing up a wall and you feel it restricted here, take a minute, dig on that pec minor, and you don't have to know the anatomy. But just again, this is a bit like peeling an onion because there's so much going on in the shoulder. But the good news is that once you know the secret that healthy tissue doesn't hurt when you press on it, then all the tissue that hurts when you press on it basically is tight and needs to be released. So that's the big secret, and I hope you have both enjoyed and benefited from these videos, and I look forward to hearing how it goes, and thank you very much for your time.